When you come in as a patient, we look at the total patient, and the hygienist usually does measurements to see pocket depth, which is one indication of gum disease, looks for bleeding, suppuration, and we record all these measurements, which is a lot of work, but it gets done. And when I speak to a patient, it allows me on a graph on the computer to show them what's exactly going on in their mouth. So they see the numbers, and anything over 3, maybe 4 is a potential problem. So what we try to explain to patients is the importance of maintaining their oral health, because any inflammation you have in the mouth, your mouth is part of a big tube that goes all the way through you and comes out the back. Any inflammation there, it travels throughout your body and affects all your organs because your blood travels throughout your body. I have a list in my a diagram in my office on the wall with a picture of a body and all the potential ramifications of not dealing with dental issues. One of the things that fascinates me, and I've said this to patients, I said, if you brushed your hair and you saw blood on your hairbrush, you'd probably run to the doctor right away. But yet people brush their teeth, hopefully, and they'll spit out in the sink and they'll see blood and they'll just kind of ignore it. The thing with gum disease is it's very sneaky. And if you ignore it, it's going to bite you. So if somebody has pockets that are deeper than normal, we'll put them on a program, scaling and root planing, and we'll get in there and clean that area. And then we'll put them on a 3-month recall, because if you wait 6 months and they come back and they're bleeding again, you really haven't done anything. Whatever the patient needs, as far as things that they could use themselves, we promote water flossing, or some people call it water pick, which I'm a strong believer in, because flossing, to get people to floss is hard. The water pick is kind of fun. It's easy to use. Not only does it remove particles, but it also removes bacteria in those areas, and it takes bacteria time to regrow. So if you're constantly washing it out, it never really gets to full strength. It's up to the patient. We can only educate them and do as much as we can when they're in the office. But I'm a big believer in education and having the patient understand what's going on in their mouth.